So New South Wales continues to control the virus as best we can whilst maintaining all of our economic activity, which is something we're really pleased to do. Today I'm here with the Treasurer, the Health Minister, the Minister for Family and Community Services, Gareth Ward, who's one of the representatives in the Illawarra, as well as Chairman Dennis King from the local area health district. And we're extremely pleased to announce that as part of the government's acceleration fund, the $3 billion we've brought forward, we're boosting or providing an additional $320 million to build the Shellharbour Hospital. We know this community is growing. We know that we need to take pressure off Wollongong Hospital, Shoalhaven Hospital into the future, which is another hospital we're upgrading. And this is really about saying to the community, not only are we going to provide you with world-class health services, but in the process there will be 2,800 jobs created from building this hospital. We're going to pick a greenfield site, and we're also going to make sure that there's as much local supply chain, as much local job creation as possible during this. It is a really exciting time. It's on top of about 100 hospitals we've upgraded or built since our time in government, but we also appreciate in the region, especially growing communities, how important it is for us to build this infrastructure. Can I especially thank Gareth Ward, Shelley Hancock and a number of other community leaders who have been asking the government to do this. The Treasurer has found the dollars to bring it forward, and the Health Minister, of course, has been a strong advocate for this project from day one. I want to thank the community for genuinely coming together to support the government's decision in this regard, and now the job is for us to find the site and get cracking with building the hospital. I'll ask the Treasurer to say a few words, Minister Hazzard, Minister Ward, Chairman King, and then we'll take any questions.
Well, thanks, Premier. Today we're doubling down on our health investment here in the southern Illawarra area. A $700 million investment, that's an additional $320 million on top of the $250 million that we had put towards this project. That, in addition to the $128 million that we've received from the federal government, ensures that we will have a world-class health facility for the people of the southern Illawarra and South Coast region. It's going to be a very difficult time during COVID-19. We all appreciate that. But not only is this a great health outcome, it ensures jobs growth and economic growth during this period of time. We believe there'll be around 2,800 direct jobs created as part of this project. That will provide great support for many families right across our state. We know as part of our $3 billion infrastructure investment, our acceleration fund, bringing a whole lot of projects forward. That will provide great social outcomes for the people of our state, but importantly drive jobs growth and economic growth during this period of time. That is on top of our total infrastructure investment, which is now greater than $100 billion over the next 4 years. We want to make sure that as we get through this difficult period, our economy is as strong as possible, but there's many jobs and opportunities and prosperity for many people right across the state. I particularly want to thank the Health Minister, the Premier, but Gareth, because this project, I can guarantee you, would not have occurred but for his strong advocacy, probably too strong advocacy during this period of time. But what will ensure is a great health facility for the people of the southern Illawarra and the South Coast.
Frequency issues just with our microphones. This one, the cable one.
Sorry. Don't make us do it all again.
No. We seem to get all of your comments, but we cut out halfway through yours. Tom, my apologies.
I don't think that's a problem.
But no, we're just pulling for everyone back in Sydney, so apologies for that.
That's all right.
I'll get it.
You all right, Lachlan? Or?
Yeah, thanks, man.
All right, well, look, I'd like to say that this is actually a real victory for the local community. The region is growing. It is a magnificent area. But as we see that growth, we also understand that the most important thing for communities is health. And having hospitals available when you need them, having your medical practitioners, your nursing staff, allied health staff, working in world-class health facilities, hospital facilities, is certainly what will make a huge difference to this community. Gareth Ward and Shelley Hancock were certainly very strong advocates from the coalition government. And I think I want to acknowledge Dennis King and the entire board of the local health district, because they worked very hard. Dennis, as many of you would know, is a doctor, professor, a surgeon and colorectal surgeon. And he leads the board team down here, and he brings insights that only a physician can bring to what is needed as we move forward in this region. Margot Maines, the Chief Executive, have all been very, very strong advocates. But I also want to acknowledge the fact that this is a region with a range of different political interests, but one community interest. And I want to acknowledge the other members of Parliament in this region, including the member for Wollongong, Paul Scully, the member for Kira, Ryan Park, and the member for Shellharbour, Anna Watson. Together we have all worked on this project to make sure that we can actually deliver what is really necessary for this region, for the community. And I can't tell you how ecstatic we all are, every single one of us, to have been able to get the benefit of these additional funds that the Premier Berejiklian and the Treasurer have been able to find for us for this region. What this means is, instead of building on an existing Shellharbour site, we can now look for a magnificent greenfield site where there'll be no money wasted in terms of working around the existing brownfield site. When you're building on a hospital site, it's always challenging. You need the hospital to still be working and delivering the services. But if we can build on a greenfield site, it will make a huge difference to what we can build, and also to making sure there's no interruption to the existing services that happen at Shellharbour Hospital. So because of the Treasurer, because of the Premier, because of the incredible work of the local MPs, and I must say I also acknowledge that Gareth Ward, he's just, the energy that goes on is incredible to make sure that this is going to happen. I can't wait to make the next big announcement, which will be the site of the new hospital. Certainly we have already been looking at that in the last few months. It's fair to say that Dennis King and the entire board and the health team down here have known that this was at least on the cards and a possibility, and today it is a definite. But they've already commenced the work with health infrastructure to ensure that they have a number of sites under possible acquisition, or possibility of acquisition. We've already done the clinical services planning, which means we've worked with the doctors. We know what's necessary for this area because it's come straight from the frontline clinicians, the nurses, the doctors, the allied health staff. They've told us what we need, and we know with nearly $750 million we can deliver it. And that will, as Gareth said, and as the Treasurer said, and as the Premier said, take the pressure off Wollongong Hospital and the other hospitals, including the new Shellharbour Hospital, another $450 million hospital that we're building.